Welcome, everybody. My name is Gus Rosania. I'm a professor of pharmaceutical sciences at the University of Michigan College of Pharmacy. I will be your host and moderator today in the Exercise and Sports Science Initiative Seminar Series. We're going to be discussing a very interesting topic about the use of cannabis in athletes. So before we begin, I would like to mention that there is a Q&A feature in the bottom of your screen. The chat feature has been disabled, but the Q&A feature will allow the audience to input questions, and you can input them anytime during our conversation. And at the end, if there is time, I will read off from those questions and I will address the panel. So with that, I am very excited to be here. We will begin by introducing ourselves. As I was saying, I'm a professor of pharmaceutical sciences. I'm an expert in drug toxicity. And as part of my introduction, I have to give you a number of disclaimers. I can actually spend more time on disclaimers than talking about myself, but it just goes together. So my support, my salary support, 65% comes from the federal government. So I am bound by federal law, and without that support, I wouldn't be here. Now, you may want to ask, what do I do? So I teach several courses. I do research, but I also do a lot of teaching. One of the courses I teach is Pharmaceutical Sciences 710, that's oil. Pharmaceutical Sciences 710 is quantitative analysis of cellular drug transport, disposition, and delivery. I actually wrote the textbook on the subject. I also teach Pharmaceutical Sciences 420, which is, to my understanding, one of the first, if not the first, medicinal cannabis courses that is taught at an accredited research university in the United States. So those are the two main courses that I teach. And that is how I came to be in this position that I'm in today. In addition to what I teach, I do research on drug toxicity, and I specifically study long-term drug toxicity. I believe I'm the only researcher in the world that studies drug toxicity for very long periods of time. And we look at how drugs affect aging, whether they accelerate aging or perhaps delay aging. So that's on the research side of things. In addition, I'm a father. I have a 14-year-old daughter, and I have a soon to be 21-year-old daughter that is at the University of Michigan. So I also have a responsibility to my daughters and my family in terms of the work that I do. Lastly, I am also supported by the Kairos Cannabis Research Foundation. And this is a foundation that organizes athletic events. So they organize races, and with the funds that are collected through these athletic events, they actually come to my research, and they fund research on the nutritional aspects of cannabis and how they affect athletic performance and how they affect human health. So with that, I will let the rest of the panel introduce themselves. So maybe we can start with Jeff.
Hey, thanks for having me, Gus. My name is Jeff Koenen. I'm a clinical professor at Florida International University in Miami. By trade, I'm an athletic trainer and a physical therapist. I'm the director of our Doctor of Athletic Training program, and I also direct at our own university the global initiative for cannabinoid education and research. And lastly, I'm the chair of a task force for the National Athletic Trainers Association Clinical Cannabis Task Force.
Joanna?
Thanks, Gus. Some of that pharmaceuticals that you were talking about that are sort of anti-aging or delay aging, maybe we can have a talk after this about what those are, and you can provide me with some of those. I'd like to age backwards instead of forward, if that's possible. Is it possible?
It's starting to look, it may be. So, but
well, we definitely need to talk. My name is Joanna Zeiger, and I am a former professional athlete in the sport of triathlon. I was fourth in the Sydney Olympics, and I was the Ironman 70.3 world champion in 2008. I have a PhD in epidemiology from Johns Hopkins Bloomberg School of Public Health, and I am probably one of the very few cannabis epidemiologists in the US. Because it's sort of a new field of being able to study cannabis. It's really gotten, it's starting to take hold more than it ever has been before. I am the founder of Canna Research Foundation, which is a nonprofit organization that is dedicated to looking at how cannabis impacts various demographics, mostly patients such as people with IBD or rheumatic disease, asthma and allergy, to look at the adverse effects and the benefits of cannabis and how they're being used in these populations so that we can get some baseline data before clinical trials can start. And I should also say that I'm a medical cannabis user myself.
Thank you very much, Joanna. Kevin.
Thanks, Gus, and delighted to be with all of y'all here today. My name is Kevin Banke. I'm a research investigator in the anesthesiology department and chronic pain and fatigue research center here at University of Michigan. Did my PhD in public health also at U of M, and then started studying cannabis in about 2013. I've taken a few different approaches with my research due to some of the legal issues and research barriers that we'll be discussing in more detail a little bit later on. It started out with more observational survey-based designs to understand how and why people are actually using cannabis, and showing, in fact, that many do use it in the context of as an opioid or medication substitutes, or replacing different medications with cannabis, and then also quite frequently for chronic pain. I've then tried to take those findings and am now pursuing them with more rigorous study designs through NIH-funded clinical trials to better understand the effects of CBD and THC and other preparations of these compounds in different types of pain and symptoms of pain. So looking forward to our discussion today.
Great, thank you all for being here. So I'm going to start asking questions now. And as I do in my teaching, I like to, especially when we're doing this online presentations, I like to do a little show and tell. So I'm sure you've probably seen this in the supermarket store. It's in Costco and major. So Hemp Hearts. Tom Brady has videos now on this TB12 program where they highlight the benefits of hemp as a superfood. And then if you go to the supermarket, I don't know if you've seen this, Dr. Teal's. It's pure Epsom salt soaking solution. It says cannabis sativa. Then it says hemp seed oil. Okay, and I'm gonna read to you. Pure Epsom salt soothes aches and pains. Then hemp seed oil moisturizes and softens skins, and the essential oils calm the mind and body. This is what you get at a supermarket. Now, you've heard about hemp, you've heard about cannabis, and you also hear about marijuana or marijuana, because some people write it with an H, and so others write it with an J. And then Sha'Carri Richardson is taken out of the Olympic team. So my question is, what do all these terms mean? We're all confused. And what should we tell athletes? And how should we tell athletes so we can come up with clearer guidance in terms of how we're going to deal with what's happening on the cannabis front? Presumably, these products are federally and state legal since they're available everywhere. So what are we going to tell our athletes? Let's begin with Jeff.
I'm happy to take any question that has Tom Brady in it and try to address this. So, one of the biggest challenges we have in this whole cannabis space is education. And some of us alluded to it earlier in the introductions. And we have to put away a lot of the fallacies and the myths associated with cannabis to learn where we are today and why we're here today. And a big part of that is actually the terminology. Oftentimes, in a lot of areas of what we do, we have interdisciplinary differences in our terminology. And here, I don't even know that we have standard agreements within our own disciplines, right? So I'm gonna tackle this based on your question, but I'm sure others will have different approaches to this, right? So in the simplest format, if you take the three words that you mentioned, cannabis, THC, and hemp, in the simplest format, cannabis is the plant, and that's what comes out of the ground, right? And by definition, anything that inside that plant has more than 0.3%, not 3%, 0.3% of THC in that cannabis part you have is considered THC based, versus anything less than that is called the hemp part of the plant. Okay, now there are various ways to say what I just said differently, but I'm going to read you something that's really, really important that nobody talks about, that I walk my circles around. In 1976, there was a research article published by Small and Kronbeck. And in the article, they say as follows: it will be noted that we arbitrarily adopt a concentration of 0.3% dry weight basis as what we will call Delta 9 THC. To my knowledge, this is the first writings off a definition of what hemp versus THC is. And the key word there is arbitrarily. So I'm going to leave it at that and let the others chime in on whatever definitions that they want to apply here.
So let's move on to whoever wants to comment next. So cannabis versus hemp versus marijuana or marijuana. How should we explain this to athletes?
Well, even within the world of hemp or CBD, there's some distinctions that need to be made between full spectrum, broad spectrum, and isolate. And so if you're looking at CBD and you're purchasing CBD and it says full spectrum CBD, that means that it has all of the components of the plant, including that 0.3% or less of THC. Whereas the broad spectrum does not have THC, and CBD isolate means that they've stripped apart the plant and only have the CBD in it. So that can be a little confusing, because if you're using full spectrum CBD, you might be lulled into thinking that you can't test positive if you are drug tested for THC, because the amount is so low in any single dose. But if you're using it daily, then you might test positive because that THC can build up in your system. And just to be clear, THC and CBD are two of the many cannabinoids that are in the cannabis plant. So there are over 100 cannabinoids in the plant. The most popular ones today are CBD and THC. And people are now experimenting to see the effects of things like the acidic forms of it, CBDA, and there's also CBG and CBN and Delta 8 THC. So there are lots of cannabinoids in the plant, but the two that are most popular, that are the ones that most people are using on a regular basis, are the CBD and the THC. And the THC is what athletes need to be concerned about if they're being drug tested.
All right, so
do you mind if I chime in real quick, Gus?
Well, so give me a second, because maybe you have something here, Kevin, because I also mentioned marijuana and, marijuana, okay? And so we've been talking about hemp and THC and CBD. So where does the marijuana or marijuana come in here?
Yeah, that's exactly what I was about to address. So yeah, just to go back to those three definitions. So marijuana is a term for cannabis that was typically used in prohibition campaigns that actually made marijuana illegal and criminalized, started in the 1930s. codified in place in the 1970s. So that basically just refers to cannabis that has more than 0.3% THC. Now, hemp, as Joanna and Jeff mentioned, is cannabis that has less than 0.3% THC, and then cannabis is just the name of the species. THC is the intoxicating component of cannabis. It causes the cannabis high, but it also has known therapeutic properties, including potential for pain relief. It can help with sleep and is appetite stimulating as well, which is why, one of the reasons that the medical cannabis laws were passed in the early 90s, 1996 in California, was because of the use of cannabis for cancer and HIV-related symptoms, including this appetite stimulating process. And so in contrast, CBD is non-intoxicating. It does not cause the cannabis high, and its main known medical value at this point is as an anticonvulsant in childhood epileptic conditions. But there's a lot of other preclinical data, observational data suggesting that people use it for many other things, including enhancing athletic performance, including anti-inflammatory activity. But those, unfortunately, those data have mostly been confined to either non-human animal studies, survey studies, or anecdotes, rather than the classic rigorous randomized control trials that we would hope to see, and that hopefully will soon be coming to better inform this space. And I just lastly want to say as well that when we're thinking of the legality of some of these compounds, hemp is not regulated under the Controlled Substances Act. It is federally legal at this point due to the 2018 Farm Bill. Medical cannabis is legal in states with medical cannabis laws, but it's still federally illegal because anything with greater than 0.3% THC in it is illegal under federal law. And then even in states that have adult use cannabis, such as Michigan, where anybody who's 21 or older can go to a dispensary and purchase it, all those products under federal law are still illegal. And that really prevents researchers from being able to adequately study those compounds and those preparations because of that legal mismatch.
I also want to make mention of something called the Entourage Effect. And that is the notion that the whole plant is what gives the most benefit. And so that means that taking out the THC, so using the CBD without the THC may not be as effective as adding in or keeping the THC in there. And studies that we've done and many studies that have been done by other people have shown that the combination of THC and CBD provides the most benefit. It also has the most adverse effects because THC can have a lot more adverse effects than CBD does, but you'll also have those benefits that you're looking for pain reduction, sleep, and anxiety, and some of the other things that the THC does medically.
I would like to develop this conversation around CBD and THC a bit further. And I would like to bring this topic of opioid use, which is now very concerning because we're facing a big opioid epidemic. And opioids are prescription drugs. Doctors are able to write and recommend prescriptions, and athletes are using opioids in the locker rooms. But then they're prohibited from switching to cannabis because cannabis is illegal, or because it's not permitted by these athletic government bodies, yet opioids are perfectly legal. So how does the efficacy and the safety compare between the cannabis, THC, CBD, and the opioids? And what do you have to say about what the athletes are doing in terms of, how they go about using these drugs to either enhance athletic performance or simply help them recover and go through injury and pain associated with athletics?
So I'm happy to tackle the first part about THC, CBD versus opioids in the pain management context. So at this point, we know that opioids are pretty, what's the right word here? There's not much support for their use in chronic pain. They're very helpful for acute pain, so like a bone break, surgical settings. Excellent tool when you start giving them to people to use in a chronic condition, chronic pain context, months, years, etc. Typically not a great choice, just because there's risk of toxicity and death from overdose, as well as many other side effects that show up there. We also know that simply they're just not that effective for chronic pain. On the cannabis side, there's been quite a few clinical trials of mostly a combination of 1-to-1 CBD and THC, THC alone, or inhaled cannabis products for chronic pain. And they typically show that there is some small benefit for pain. There are some side effects, but no lethality or anything like that. And so if we're looking at it from a harm reduction perspective, it's clear that cannabis wins out over opioids in the chronic pain context. In the acute pain context, opioids are probably more appropriate at this point in time, given that we know that they work. And if they're prescribed for a short amount of time, they can be effective there. I will say the major caveat of the cannabis clinical trial literature is this criminalization component that has meant that it's been incredibly difficult to conduct the type of studies that we would want to see using, products that are available to all of us. And I know that, from the studies that I've conducted, that the way people use these products is far different than what you see within the structure of a clinical trial. So in a clinical trial, people take a fixed dose, typically in a fixed way over a certain amount of time, while with the use regimens that people develop on their own, they get to mix and match different products to manage their different symptoms. They might be managing multiple symptoms at once, such as sleep, pain, and anxiety together, often using a combination of CBD and THC and routes of administration with different effect onsets. So it's just a really major limitation of that literature at this point in time. And I'd love to hear some of the other panelists' thoughts on this too.
Well, there's been definitely mixed results about whether or not cannabis reduces opioid use. There have been studies that have looked at states with legal cannabis and whether or not opioid prescriptions have gone down. And there's been some sort of mixed results in there. One thing that they have seen is that people that use cannabis and opioids together, that cannabis can enhance the effect of the opioids so that you don't need to use as much opioids, so that the opioid will last longer. And so that's also a very positive effect, that sometimes cannabis is not the be all end all. It's not going to, if you have very severe pain or you have a disease with a lot of symptoms, it may not be able to do all of that heavy lifting of being able to mitigate all of those symptoms. And you still may need a benzodiazepine, you still may need an opioid, but when you put the cannabis in with it, you may need much less of it. And you may be enhancing the effect of those medications. And so I often look at cannabis as being part of a multimodal approach to health and wellness, whether it's for athletes or medical patients.
Yeah, I'll add just a little bit here. One thing is the addictive factor. So there's certainly potential for addiction of opioids and even harder drugs through chronic use, whereas we haven't technically seen that from a chemical perspective with cannabis. There's certainly social addiction that's possible. But let me bring this down to the playing field, if you will. The analogy that I like to use is that the science hasn't caught up with the reality. You know, when you see that brand new paved sidewalk on campus, but then within a month, no one's walking on it. They're taking a shortcut through the grass, and you see the grass worn out and the dirt there. In an athletic world, I need to be fixed today. right? I'm not worried about even 4 hours from now or a month from now, or if I have a knee injury and you say, well, I better do this because 10 years from now I won't be able to run. I'm not worried about that. I have a career that peaks and has some window of time to perform my best in. And so there's still a concern that is kept sort of in the underground, if you will. As Joanna mentioned, more athletes than you know are truly resorting to cannabis in various forms for various reasons, whether it's pain reduction, inflammatory reduction, anxiety, performance, sleep, a lot of different areas. But the reality is that they still have to be careful while they're still actively participating. A, because of some of the unknown laws, and B, because of the stigma that's still there. So if I'm using something and I'm an active athlete and I just have a bad outing, a bad season, a bad series, whatever it is, and now someone comes back and says, well, it's because of this, I could potentially lose contracts and opportunities and things like that. So there's still a concern. People are talking about it amongst each other. And the key here is to bring it out into more transparency. And that's where programs like this, where we can openly talk about the realities and the facts. What are the limitations? Kevin referred to the federal limitations that prevent us from doing some of the studies that we want to do. Fortunately, since the Farm Bill passed, we've been able to do a lot more from a hemp standpoint and a CBD perspective. But I would argue that the area we know the least in is about dosage. And that's where I scream, as much as I don't want more regulation on anything, I scream for regulation here, because to legalize and know that I'm getting the same batch from the same company when the label says the same thing each time is critically important. And to better understand, is something I'm recommending for an athlete, is it going to be based on their body weight, their gender, or what are the other characteristics that come into play? And I long for the day where we can do what I call endocannabinoid profiles, where just like we draw blood and we say, you know what, you're deficient in X, and so we're going to put you on this pharmaceutical. Well, maybe we can do something and find out in a profile that, you're an anandamide, an endocannabinoid in your system is low, and therefore we can supplement it with a phytocannabinoid, one of these cannabinoids that come out of the plant. And I compare that to vitamins nowadays. Right? If you walk up and down the aisles of a drugstore, you'll see the multivitamin. And the multivitamin is what Joanna referred to as that full plant, right? You have all the cannabinoids in it. But you can walk further down the aisle and you'll find vitamin A, vitamin C, and vitamin D. And we know what they're for. And we see a dosage on a label. And I think sometime in the future, hopefully in my lifetime, you'll start to see something like that. You might see isolates. You might see various broad spectrum combinations, and then you might see the full spectrums. And who knows the future of recommended medicinal marijuana.
Well, when you're talking about dosage, oh, sorry, Gus, I just want to say about the dosage. People have no idea how much they're taking.
Yeah, so I want to address this, and I think a lot of really interesting points have been brought up, but I would like to address this from a safety standpoint. So we're talking about the whole plant, we're talking about the components of the plant, we've compared the components of the plant to vitamins, and then we've got opioids. And there has been 80 years worth of research into cannabis to show the toxicity and how bad it is. So how does the toxicity of the plant and the components in the plant compare to, say, opioids or compare to vitamins? So on the safety, so let's think about the safety side of things.
Well, I think that a lot of the proponents of cannabis will tell you, oh, cannabis is like the greatest thing ever, and it works for everyone, and there are no side effects, and life is wonderful when you use cannabis. And that is not the truth. I mean, there are a lot of great benefits for a lot of people with cannabis, but there are adverse effects. Now, it's not, as Jeff said, you're not going to have lethality from cannabis. There aren't any documented deaths from cannabis, which is why people are looking at it as a substitute for opioids, where there have been so many deaths from overdose. But some of the adverse effects that you might see from THC are cannabis hyperemesis syndrome, which is vomiting and severe abdominal pain that lands people in the emergency room. And as soon as they stop using cannabis, that goes away. And then they start using cannabis again. And sure enough, the hyperemesis comes back. Some people have experienced psychosis from cannabis. Cannabis is one of those drugs where it can reduce anxiety, but can it also cause anxiety? People have spoken about taking too much cannabis or THC and hallucinating. It can impair your ability to concentrate, which is why people are very concerned about people driving high. So it can cause some respiratory adverse effects if you're inhaling it. So people can cough or wheeze, which can be very problematic if you have COPD or asthma. And it can also, for some, increasing appetite for some people is a benefit if you're having nausea and you can't eat, but increased appetite can also be a deterrent if it's not something that you're looking for. So cannabis is not without its adverse effects, but in many of the studies, the benefits far outweigh the adverse effects, and the percentage of people who are saying that they're having benefits is much higher than what they're saying is not beneficial or adverse.
So Gus, if I could add to that, yesterday I read an article that said if I drink caffeine, it's not good for me. And today I read one that says it's great for me. And the same thing with chocolate and everything else, right? And so surely, we're not going to base this on one study. And I would imagine we will see lots of work as more studies evolve that are going to show us both sides of this. And I think the key is, again, the benefits and the risk. And like Joanna mentioned, a lot of this is dosage. If you take a low dose, you might see reduction of anxiety, and you continue to increase that dose and it reverses and it goes the other way around. But think about where we are in this world today. The Lambert Institute in Australia just recently proposed guidelines to its government to consider, and they suggested that low dose cannabis be acceptable for individuals who drive if they have Parkinson's or a condition with tremors. Would you not rather have them driving and control the tremors under low dose cannabis or not? And they even went as far as to suggest the same thing for surgeons. Would you want a surgeon with a scalpel who has a tremor operating on you, or someone who takes cannabis, i.e. a medication of some kind? So the amount of work that's going on there and the innovation to say, where can this really help? And like anything else, if we don't understand how to use it, how is it dangerous? But what really scares me is Joanna referred to the hyperemesis. If you look at the research on hyperemesis, we learned a lot more about this after the adult use bills were passed in various states, because we were seeing higher emergency department visits with this condition. What's the treatment for this? Number one, stop smoking, as you heard. Number two, IV hydration of fluids because you've uncontrollably vomited up for the last how many hours. And number three, a hot shower. And that's in peer-reviewed literature. Certainly, there's got to be a better approach or a better preventive measure.
Hyperemesis translates to vomiting, uncontrolled vomiting.
Uncontrollable projectile vomiting, correct. And we've been looking at this. Nobody has really identified the cause yet. Is it triggered by the amount? Is it triggered by the amount within a certain period of time? Is there any genetic component to it? We just don't know. But the deterrent.
So some people are saying it's something that they're adding to, to the cannabis, to the plant. So it may come from pesticides, herbicides, or from some. They don't know yet where the side effect is coming from.
Yeah,
so,
and it's important to know for athletes especially, but for anybody, if the deterrent is, well, just go to the hospital, get IV hydrated, stop smoking tonight, and go home and take a hot shower, and you'll feel better within 2 days. That's not always the case for everyone. This can last and continue to go on, as noted earlier. And so this is another area where we want to learn more about these side effects, both short-term and long-term.
Yeah, and I would just, I think y'all did a wonderful job summarizing that. I think it's important to, just when we're doing this, think about one thing that cannabis in a lot of these toxicity harm studies is viewed on its own and in a vacuum rather than in comparison with many of the other medications or compounds that people use, which is why I think the opioid crisis really has thrust cannabis into the limelight in a different way as a harm reduction option. And then the other piece is, in terms of toxicities and harms, one of the biggest risks associated with cannabis is the fact that it's criminalized and not regulated in many situations, especially CBD products. Well, CBD products are not criminalized, but they're also not regulated. And I'll just, harp on them as an example. We don't have federal standards for CBD products. And if you look at the scientific literature, there's a proliferation of papers that are showing up saying the amount of CBD that is claimed to be in there is wrong. Maybe it doesn't even have any CBD. Maybe it has THC. Maybe it has a synthetic cannabinoid, which unlike CBD and THC could actually kill you. The pesticides, heavy metals, other adulterants. We saw with the lung-related disease from vaping semi-illicit cannabis cartridges. Part of that is due to the fact that these are not regulated products. Again, CBD probably the worst. The medical or adult use products tend to have a bit more regulation because the states, once they have these markets in place, they do put regulations on vendors and sellers and growers and processors. So I would just note that the fact that we're keeping this stuff illegal and keeping it in this legal, unregulated space actually harms everybody who's trying to use it as medicine.
I agree with you, Kevin. So I have here my little bottles and boxes. So I try this all the time. They're available in the store, and they're not regulated. Their labeling is very ambiguous. But what's actually even more concerning is you have the smoke variety, which is, I think, what most people think about versus these drops. And what do you have to say about the smoking versus the drops? How do those compare? And what do we actually know about them to give people, athletes advice in terms of how they should go about using and introducing these substances into their bodies?
Well, if we're talking about athletes, I would definitely say that inhalation routes probably are not going to be the best because we don't know really the long-term impact on the lungs. And especially if you're using products that have not been regulated and you don't really know what's in it, as we saw last year or the year before, when the vitamin E acetate was contaminating a lot of the cartridges in what Kevin described as the semi-illicit, or was it Jeff? I can't remember, but the semi-illicit cartridges. And so for athletes, I just think that other routes of administration are going to be healthier and safer. However, when you inhale it, you're going to get a much more immediate effect. Whereas if you take the drops or you use an edible, the effects could take anywhere from 30 minutes to over an hour to kick in, which people sometimes don't remember, they haven't been told, or they forgot. So they'll take an edible or they'll take some drops and then they say, gee, this just isn't working. I need some more. So they take another edible and then they're like, oh, I'm still having pain. I need more. And then all of a sudden it all kicks in at once and they're so high. They've never been that high before. And they're just really having a hard time because of that. And that's where the education component, seminars like this are so important to get the word out that if you are going to be using edibles, that you have to be very careful with your dosing of it. And the nice thing about the edibles is that it's very easy to dose. If you have one gummy that has 10 milligrams, let's say, of THC in it, that's 10 milligrams. And if you only want 5, you can cut it in half, but you still have to wait that period of time for it to kick in. When you're going with inhaled routes of administration, it's harder to know how much you've taken. With the bottles, the labeling is often terrible. You can't read it. You have no idea what's in it. A lot of people call me because they know that I work in the cannabis space and they say, well, what should I be taking? And I say to them, well, how much are you using right now? I'm using 3 drops. Well, what does that mean? I say to them, well, how much is that? I have no idea. And so most people really don't even know how much they're taking because the labeling is terrible. It's not the same across products, and people don't even look anyway. They just take the advice of a friend of theirs. And so they could be using a product that's not been tested by a third party, and it has some contaminant in it, and they don't even know how much they're taking.
So I want to jump on that because you just described my world. Okay, a couple of years ago, before the hemp bill passed, farm bill passed, any athlete that asked me about a product, my answer was easy. No, you can't take it. It's against the rules, it's against the laws, and anything you put in your body, you're responsible for, and you're going to be tested. And I had an easy way out. But now things have changed with laws and professional regulations within organizations. And so I have a huge obligation as a healthcare provider, and as does every other athletic trainer, physical therapist, physician, you name it. When the athlete you're working with says to you, just like they walk up to you with anything else, they could find a GNC or anywhere else and say, hey, what is this? My neighbor said I should take this, and my friend on this team said it works and it helps their pain. What do you think? Now I have an obligation to be educated on this, right? So I could say, no, stay away from it still, of which point that's not helpful to them. I could say, I don't know, that's not helpful to them. And so I have an obligation as a professional to up my game and become educated in this space. And part of that space is the labeling. So one of the things I tell people is if there's no labeling, just throw it out in the round pile right behind you because you have absolutely no idea what's in it. If there is labeling and it says, well, 20% of this product's proprietary, throw it out in the same trash because you don't know what that 20% is. And then if it has a QR code that you can look up with your phone to a certificate of analysis, that's a good starting point. You can learn how to read what's in it based on that certificate if the certificate is accurate and comprehensive. So it can tell you what percentage of this product is CBD versus CBN versus et cetera, and also pesticides, as Kevin alluded to earlier. Not all of these are accurate, but it's a good starting point. And also, when you look at those, you can identify the batches consistency when they come out. But this all goes back to the lack of regulation and understanding how the lack of regulation hurts all of us in the ability to properly advise people and individuals on what they should or shouldn't put in their body.
I should, apropos to that, because of this lack of regulation, and it's very hard to know which companies you should trust in the CBD space. One other thing is to look at their website, and if they're making egregious claims like, it's gonna cure your toenail fungus, and it's the cure for, male pattern baldness, and it's going to, fix your dry skin, and it's going to do all of these things. Yes, Jeff, for you. But
doesn't work.
Says, have you rubbed it on your head and just, really massaged it in? Maybe not doing it right. But the point being that if they're making these egregious claims on their website that haven't been substantiated, put them in that pile that Jeff was talking about of throwaway, because when they're making these egregious claims that haven't been substantiated, I don't trust that product. And if you're looking for products to trust, because we've talked a lot about products that you shouldn't trust, a lot of there are third-party companies or universities like consumer labs and other entities. I think even Leafly have done testing on hundreds and hundreds of products that they have just bought off the shelves, tested them, and they make their recommendations based on their analysis that they've done. And I think that's a really good way to find products that are trustworthy.
One thing that I just add to that is, yeah, sure. So I think it depends on the type of products we're talking about, right? So if we're talking about CBD products, all of those things absolutely make sense. When we're talking about the state regulated products, as I mentioned before, they're a little bit better regulated just because they have, some structures in place for testing for potency and safety. So I guess I kind of think of there being a hierarchy between the products, and that the ones that are state regulated for those of us who live in legal, medical, or adult use cannabis states probably have the best regulation. Then CBD products and illicit products CBD products that have good testing, that have those QR codes, that have that independent testing are probably at a similar level to the state licensed products. Those that don't are a step below. And then, you know, what you get illicitly is probably even less, it's certainly even less regulated than those other ones. So just to build a mental model around that.
These are really 4 different conversations here, right? You can have an entire conversation about medicinal marijuana and what state it's coming out of. Is it what we call vertical or horizontal guidelines by law, which determines from seed to sale, how it's regulated. Then you can have the whole conversation about adult use or recreational, the old term, whereby, for example, I could play for the University of Michigan and I can go down the street to the dispensary and buy some, and all I'm doing is breaking a team rule because the team says I shouldn't be allowed to take some of this now while I'm in season, for example. Then you have the entire hemp-based industry, right, which is a whole different set of, I would say, regulation or lack of regulation. Then you have the black market, which has always been there and probably always still will be. And now, by the way, you know, ramping up quickly around the corner is pharmaceutical, synthetic-based and derived cannabis. And so each of these are an entire conversation, individual of one another, sort of how Kevin was referring to, because when you start to talk about safety and efficacy and things like that, they're all managed differently. And when they hit the consumer, that determines what's coming into or onto your system.
Jeff, you're missing the big white elephant in the room, which is the federal government, and the fact that cannabis is still Schedule 1 of no medical use whatsoever. So maybe this is worth some commenting, since we've been having an active discussion around cannabis and its benefits or a risk. But how about the U.S. federal government and where it stands, especially in relation to the United Nations that has already descheduled cannabis from a completely illegal substance into one that now can be prescribed and has medical uses. So where does the federal government stand, and what should be done about this?
Well, as you mentioned, the federal government right now says it's Schedule 1. And what does Schedule 1 mean to those listening here? It means it's in the same category as LSD and heroin, right? And so from that standpoint, that's what's preventing us from doing studies on cannabis. And fortunately, parts of it have been teased out. Everything used to be Schedule 1 until we had a few CBD drugs that passed through the FDA, as Kevin alluded to earlier, and now hemp products. But until that changes, and by the way, going back to what Joanna said, she's absolutely correct. No CBD company is allowed to make any medical claim right now that any of their products can cure any medical conditions. Now, I'm not saying you won't see that on labels and on websites, but once you get big enough as a company and the FDA catches on to that, then they come after you and they write you a nice long letter, basically as a cease and desist type approach. But the fact of the matter is, until we have good randomized controlled clinical studies that can show the efficacy of this, then it's still not going to be reclassified entirely from Schedule 1.
I think that
you want to
mention
some scheduling? Yes, go ahead.
I think that you know, as the U.S. popular feelings and attitudes around cannabis change. I mean, you know, most of the people that have been surveyed about whether or not they think that cannabis should be legalized have said yes. So over 50% of the population believes in legalizing cannabis in some form, whether it's for medical use or adult use. And so I think as we see more people screaming and shouting that they want it legal, I think that will help. I think that, you know, the NBA and the NFL, they have a lot of clout, and they are now doing studies on cannabis for their players. And if they legalize cannabis, and if the World Anti-Doping Agency, which oversees the drug testing for a lot of the athletes, if they legalize it, which they're looking into now. I think that these are all things that are going to push it forward toward having it descheduled, because the more players who have clout that start allowing it and legalizing it within their auspices, I think it's going to put a lot of pressure on the federal government to deschedule it so that we can do the proper research so that people can use it in the most effective way, and that we can answer these questions about dosing and frequency of use and what combination of THC to CBD is going to work best for various symptoms. And so it's going to come down to really public opinion and some bigger organizations saying, hey, we're going to legalize it.
So there's two different concepts. When you talk about drug schedules, you're talking about the benefit that a drug can provide versus the risks associated with it. And so in the Schedule 1, we're basically saying the message is cannabis is entirely bad and there's nothing good that can come out of that. And we at least know that that's not true. So we have to get to the point where we show the studies that the benefits outweigh the risk to schedule under a different level. But let's look at other organizations. The purpose of the NCAA and other organizations that regulate sport leagues is to create an equal playing field, right? So they're on record, all of them are on record saying that cannabis is not a sports performance enhancer. And there's some studies out there that do show that so far, indirectly. But if it's not an enhancer, then why is it banned? In other words, if I take a steroid and I know that I'll be bigger and stronger and I can run faster, hit more home runs, that's an unequal playing field, and that's not fair. And yes, I should be tested for it. But if it's not an enhancer, it doesn't need to be tested for, and it should just handle from the medical side. So whether it's from an anxiety perspective, what I like to say is the following, okay? If you're one of my athletes that I'm taking care of and you have a knee injury and it's painful and swollen, I can use ice and massage and whatever other techniques I want to treat your symptoms. I'm not enhancing your performance directly. I'm reducing your symptoms to bring you back to an equilibrium state of where you can perform. And that's the exact same argument that athletes are using nowadays with cannabis. It's not enhancing their performance directly, but what it is doing is minimizing or removing those symptoms so they can perform back at a level where they want to be. Now, what's the message from the NCAA over the last couple of years? Well, the test that was positive for cannabis in the past came with it a 1-year automatic suspension for sport. And the sensitivity level was 15 nanograms in a test. And a couple of years ago, the NCAA changed that. And they increased the sensitivity level to 35 nanograms, and they reduced the penalty to 1/2 of a sports season, 6 months. So isn't that a message of somewhat of receptiveness, a little bit more leniency? So they're heading in this direction. And so a number of universities that I worked with recently have communicated with the NCAA and said, please take a look at this again. Take a look at all things cannabis. The other interesting thing is the NCAA bans all cannabinoids, not just THC, but the only thing they can test for is THC. So athletes are afraid that if they take any other isolate, that they still run a risk of having THC in their system and testing positive. So again, a lot of this is education, but I believe the NCAA has recently surveyed all the universities at all the divisions to ask them what their stance is on their current perception of cannabis use in their athletes. They're looking at the results of these studies. They're going to sit back down, the medical safeguards group will, and make a decision on where we are today relative to not only NCAA, but in comparison to the other organizations, right? Because what we don't want is a scenario where you have a different role in one location or organization versus another. So if I'm Joanna, which I would never myself be able to compete at the Olympic level, but if I was, and I was training in the US and I was using CBD on a regular basis, but then I was going to Tokyo for the largest event of my life, and I can't even bring the CBD through the airport with me, now I'm a little bit, I'm nervous because I can't train the way for the peak time that I'm ready for.
And there's one other.
57. So we have 3 more minutes. So I would like everybody to wrap up with a 1-minute summary take-home message that you would like to leave the audience with. So Joanna, since you're mentioning we're about to speak, so why don't you go ahead with your 1-minute take-home statement?
Well, my 1-minute take-home statement is that cannabis can be very effective for many people for many things, but it's not a cure-all. It has to be used carefully and researched. And if you can, speak to a cannabis physician or a cannabis nurse to make sure it doesn't interact with anything that you're taking. One of the problems with drug testing in the NCAA or with the World Anti-Doping is that we don't know how much THC will get you to that threshold level. It's different for everybody because everybody's metabolism is different. So if you are being drug tested, the best thing to do is just not use THC because you just don't know what that level is going to be. So use it with caution and, good health, have good health.
Right, 1 minute. So Jeff, Kevin, I don't know who wants to be, maybe Kevin want to close? You want to close,
Sure.
Kevin? All right, so Jeff, 1 minute, keep it to 1 minute.
I can do it really quick. I'm going to put 2 shameless plugs in because we've talked a lot about the importance for research. I also think there's a lot needed for education. So I teach a 4-hour cannabis healthcare educator certificate program. And the idea is to help all the healthcare providers have basic cannabis 101 so they can learn how to speak to the athletes. And the second thing is, I hope you all can come to our first inaugural Sport Cannabis Conference in Orlando next summer, sportcannabisconference.com. You can look it up. We believe it's going to be the first and only one of its kind, and we are partnering with Athletes for Care. We're looking forward to a great turnout for that. And putting this on the table, talk transparently about the science behind cannabis.
Thank you very much. Kevin, you got closing remarks.
Sure. So thanks again for hosting this panel today, and delighted to be with y'all. I think I just want to add that when people are considering adding cannabis to their treatment regimen, just to be thoughtful about it. If you're going to trial cannabis, approach it like you would another medication, track your symptoms, track your use methodologies, and given what we know that different formulations and different cannabinoids affect people differently, start low and go slow. And in so doing, you can hopefully better figure out if you're somebody who would be responding to cannabis in a positive way. And if you're not, then you've given it a shot and it's a good time to discontinue. So just, again, being thoughtful and judicious about that use should you plan to use it in an athletic or other context.
Thank you very much, Kevin. Thank you, Joanna. Thank you, Jeff. It's been a pleasure to be moderating this fantastic discussion today. So thanks the athletics department and the University of Michigan Office of Research for sponsoring this event. And I guess we'll see you all at the next seminar of the Exercise and Sports Science Initiative Seminar Series. Thank you very much, all. Have a great afternoon.
Thank you very much.
Thank you.